Good afternoon. I'm Annette Vanderveer with the Human Services Department of DeKalb County. I want to welcome you to our Lunch and Learn today. And we have a very dynamic speaker for you, Cantrell Foster. Before I go into her bio, I'd like to just remind you when you have questions to put your questions in the Q&A and we will take them toward the end of her presentation. So now let me introduce Ms. Cantrell Foster. She is a native of Atlanta. She was raised here. She is a licensed health insurance agent with Sonder Healthcare. She attended Clayton State University and holds a Bachelor's of Science degree in nursing. She enjoys educating seniors about their options in Medicare plans at churches, health fairs, gatherings, and their place of residence. She is always helpful in connecting her community with resources and essentials. She is a volunteer with the Center for Black Women's Wellness and Learn to Grow, Inc. Both are nonprofit organizations that seek to empower families and communities through health and wellness. Please welcome Cantrell Foster.
Hello, everyone. I am Cantrell Foster. Thank you, Ms. Annette, for that beautiful introduction. I will be representing Sonder Health today. It's a Medicare Advantage company. Our motto is Georgians serving Georgians. So these are the plan highlights. We have 5 CSNP plans, which are chronic special needs plans. We have diabetes wellness for individuals with diabetes. We have Sonder Mind Matters, that is for individuals who have dementia and Alzheimer's. We have Sonder Renal Health, that is for individuals with ESRD, which is end-stage renal disease. Taking dialysis. We have Sonder Breathe Well, that is for individuals facing asthma, COPD, and any other lung conditions. We have Sonder Heart Healthy, and that is for individuals facing chronic heart conditions such as heart failure and other heart issues. So for our Sonder's Diabetes Wellness, a person would receive, should they qualify and have diabetes, they will receive a $250 flex card per month, a $130 grocery card per month, 10 meals per month, 50 non-medical transportation rides, 0 cost for most of their insulin, $10 home health fee, $0 for your tier 6 drugs. You will receive $500 on your flex card for dental, vision, or hearing. You'll receive $2,500 towards dental comprehensive and preventative services, and you'll receive $150 for over-the-counter per quarter. So that's about maybe $50 per month for every 3 months. We have our Sonder Mind Matters. You will receive a $325 flex card per month, and that can go towards adult daycare in the flex card. That's within the flex card allowance. You'll receive a $100 grocery card per month, 10 meals per month, 10 non-medical transportation rides, $10 home health fee, $0 for tier 6 drugs, $0 in home health support. You'll get about 208 hours per year. You'll receive $200 towards dental, vision, and hearing, $1,000 towards dental comprehensive and preventative combined, and $200 for over-the-counter per quarter. So that's a little over $50 every month, every month for 3 months. Sonder Renal Health, individuals will pay $0 for their dialysis treatment, $10 for home health, $0 for tier 6 drugs, $240 for your flex card per month, $200 on your grocery card per month, 10 meals per month, 50 non-medical transportation rides, and your additional plan benefits will be $500 towards your flex card for dental, vision, and hearing, $2,500 for dental, comprehensive, and preventative, $0 for insulin, $200 over the counter per quarter, and unlimited non-emergency transportations, such as like to your dialysis appointments. For Sonder Breathe Well, it'll be $10 for your home health, $260 for your flex card per month, $200 grocery card per month, 10 meals per month, 50 non-medical transportation rides, $500 towards dental, vision, and hearing, $2,500 towards dental comprehensive, $200 for over-the-counter per quarter, and smoking cessation will be 12 visits that you will be allowed. Sonder Heart Health, it'll be $10 for home health, $250 for your flex card per month, $130 grocery card per month, 10 meals per month, 50 non-medical transportation rides. You'll get $500 towards your dental, vision, and hearing. You'll get $2,500 towards dental, comprehensive, and preventative combined. You'll get $150 over the counter per quarter and $0 for your diagnostic sonograms, ultrasounds. Here are our HMO and PPO plans. It's as follows: Sonder Complete Health Advantage, Sonder Vitality Matters, Sonder Access Plus PPO, Sonder My Choice Medicare Advantage Plan. So for your Sonder Complete Health Advantage, 0 for your primary care provider, 0 for your premium, 0 for your specialist, 0 deductible, 0 home health, and 0 tier 1 drugs. In addition to that, you will receive see here. In addition to that, you'll receive $200 on your Flex card, $105 on your grocery card per month, 50 non-medical transportation rides, $3,000 towards dental comprehensive and preventative, and $200 over the counter per quarter. So it's pretty much the same thing as the last plan, except for it'll be $10 for your home health. In addition, you'll receive for Vitality Matters, you'll receive $250 on your Flex card per month, 6 visits to your nutrition or dietary, $40 towards your weight loss program, $90 towards your grocery card, $100 a month for alternative exercise, $500 towards dental, vision, and hearing, $2,000 towards dental comprehensive and preventative, $125 for over-the-counter per quarter, and 0 for orthopedic procedures. For Sonder Access PPO, this plan is for individuals who like to utilize doctors out of network. So you will have a $0 deductible, $0 premium, $0 for your primary care provider, $20 for your specialist, $0 for home health, $205 for your Flex card per month, $80 for your grocery card per month, $500 towards your dental, vision, hearing, $50 for non-medical transport, and $200 for your over-the-counter per quarter. Sonder My Choice. So from your PCP to your premium to your specialist, your deductible, your home health cost, and your tier 1 drugs would be 0. And My Choice is unique because you have 3 choices that you can choose from each choice, each list of the choices. From choice number 1, you can choose between a grocery card, or a gas card, or a 3,500 towards elective procedures per year, 3,000 per year for mobility device. For choice two, you can pick $4,000 towards your comprehensive dental, 3,500 towards your comprehensive vision, 3,000 towards hearing aids. And for choice three, you can pick 12 visits for acupuncture or 12 visits for chiropractic visits. And we also have a few other plans along with the plans that I've presented. We have the Sonder Dual Complete. That is for individuals that hold Medicare and Medicaid. Sonder Medicare Valaris and Sonder Harmony and Soul. So for Sonder Dual Complete, zero premium, zero primary care provider fee, $0 specialist, $0 deductible, and $0 home health. For your additional benefits for this plan, $295 flex card per month, $250 grocery card or utilities per month, 10 meals per month, 50 non-medical transportation rides, $300 over-the-counter per quarter, 5,000 dental coverage, preventative and comprehensive. For the Sonder Medicare Valaris, $0 premium, $0 PCP, $0 specialist, $0 deductible, and $0 to tier one drugs. And this plan was designed for our veterans that would like to get extra benefits in addition to what they receive at the VA. So kind of like Sonder My Choice, you choose one benefit from each of the choices that are presented. From choice one, you can choose a $285 grocery card or gas per month, $300 per month for wellness, $300 for housing or utility support per month. For choice two, you can choose 3,500 or 2,500 or 2,000 dental, vision, or hearing. You do receive for choice three, 12 visits for acupuncture, 12 visits for the chiropractic visits. For Sonder, Harmony, and Soul, you will have to pay $0 for your premium, $0 for your PCP, $0 specialist, $0 deductible, and $0 tier one drugs. You will receive $400 for your groceries monthly, or $325 for your gas card monthly, $3,500 per year elective procedures towards elective procedures, $3,000 per year towards mobility devices. All members with chronic conditions receive $100 per month towards social and active club membership, $24 towards 24 non-medical transportation rides, $500 towards herbal medicines. And for choice two, you can receive either 4,000 or 3,000 towards dental, vision, or hearing aids. For choice three, you can pick 24 visits for acupuncture or 12 visits for therapeutic massages. And keep in mind, you would have to choose one from each list, each choices. Any questions, comments, concerns? Again, this is Sonder Health, a Medicare Advantage company. Our site is sonderhealthplans.com. And here's my information. I'm Cantrell Foster, your dedicated benefits advisor.
Thank you, Ms. Cantrell. Just a couple of questions, Ms. Cantrell. Can you tell us what that you gave us a lot of information, And there's so many benefits that seniors can take advantage of. Are there favorites? There were about what, 5 plans?
Is in total, we have 12 plans.
12 plans. So
Mhm.
can you go back to that slide
Mhm.
with the plans,
Sure.
if you could? Here we go.
It's like a list of them,
Oh,
or
yeah. Okay.
I can go to the very first set. Yeah, so
So,
these
so yes, that's it. Okay, so really it depends on your status, your health status,
absolutely.
which plan you would be selecting
Right.
that would give you the best benefits of all of them.
Absolutely. For the chronic special needs plans, Saunders kind of realized that the other carriers didn't kind of have
Hmm.
plans that were specific. I believe we have more than anyone standing. And then, like for instance, these the Sonder Complete Health. If someone doesn't have diabetes, COPD, asthma, ESRD, which is in stage renal disease. If they don't have any heart issues or dementia or Alzheimer's, and say someone is suffering from lupus, Sonder Complete Advantage would be the go-to plan for them, because they would still qualify, as you can see, for that monthly flex card and grocery card allowance.
Okay. Are there any provisions? Well, you do have transportation, 50 non-medical transportation.
Mhm.
How do you qualify for this? How do you know what you qualify for?
Absolutely. Is it okay if I show a list of conditions?
Sure, absolutely.
Okay. I'm just gonna pull it up 1 second, okay?
Okay.
I'll reshare my screen as well. Um, let's see here. Are you able to still hear me?
I can't see your screen yet.
Yes, yes.
I can hear you.
You're still able to hear me, okay? I just wanted to make sure. I'm gonna pull it up for you. Yes. Okay. I'll be there. I'll be back. Okay, so I'm gonna share it. Come back and share it. See here. Okay. Okay. Miss Annette, you're able to see my screen now?
Coming up now. I can see it.
Okay.
Okay.
All right. So I am, so basically, this is what I wanted to show you. So CMS is the Center for Medicare Services, or center, as I could
Mhm.
say, and they have outlined what they define as chronic conditions.
Okay.
So what Saunders did was, as you can see, we have lung conditions to your right. We have mental health conditions. We have neurological disorders, diabetes, dementia, heart failure, like I've outlined in the PowerPoint earlier. So,
Right.
um, like I said, if you don't have a chronic condition outside of the 5 chronic special needs plans that we have presented, we do have a plan like the complete Advantage plan is something that I've been known to en- enroll someone in.
Mhm.
Should they have maybe multiple sclerosis, or maybe suffering with lupus or rheumatoid arthritis, anything that's on this list, um, that is not, outlined on the chronic special needs plans specifically designed for dementia, diabetes, and heart issues. We don't have a plan for Parkinson's specifically, but the complete advantage plan would work, so that they could utilize those benefits and features offered on that plan.
Okay. Yeah, it's just about every disease known on
Right.
your list. It's very comprehensive.
Mhm.
And it even includes stroke?
Yes, it does, and also cancer as well.
Okay. Is that must be further down? I can see
It
stroke.
is,
Okay.
are you able to see it now?
Yes. Well,
Right
it's a
here.
picture.
It's right under autoimmune disorders.
Okay, see it. I see cancer.
Mm.
Okay. 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 I appreciate your,
No
your
problem.
answers. Thank you.
Yes. And like I said before, the dual complete plan, it you have to be full Medicaid, and
Mhm.
obviously Medicare works. Medicare is the precursor in order to sign on with our plans. Um, the you have to have for the dual complete, you have to have Medicare and Medicaid in order to qualify for our plans, our dual complete plan, and that plan does afford a little bit more on your flex card and grocery card. On that particular plan, the flex card allows you to pay for your utilities. Um,
Okay.
on the flex card that we have for the other plans, you are able to pay for your cell phone bill and your internet bill, pet supplies, active and social memberships, fishing and hunting. Um, and I'll be glad to send you the summary of benefits if you needed to see them again for a more in-depth um, explanation of what we provide.
Okay. Can you talk to us a little bit about some of your, I guess, seniors' requests from you that might go outside the plan? How do you deal with that if there's something they need and this
Yes.
they
Mhm.
covered? Yeah. Okay.
Yes. So I definitely do not convert them over to Sonder if I see that it's going to cause more issues. Um, to just, if they kind of convert over, especially if they have a lot of things going on and their plan seems to suit them best.
Hmm.
Essentially, I am for them getting the most out of their plan. Like, for instance, if they have Aetna or another carrier, and that carrier has been kind of taking care of them, and Saunders can't offer them much more, then I just suggested maybe they should stay, because I understand some people have what I would like to call like a multi-condition situation. They may have diabetes and chronic heart disease. And on
Hmm.
top of that, maybe Parkinson's. So again, like if we have a plan called Diabetes Wellness, that may more so only really cater to your diabetes versus your Parkinson's or your chronic heart issues. Um, and then also, if I do know of some resources, like if Saunders is not able to maybe get them a mobile device, unless they're on one of those plans that kind of outline, hey, we'll give you a stipend towards your mobility device. Then I'll definitely reach out to partners and community resources to handle that, because it's kind of like more so a simple fix. But
Okay.
they're pretty much majority fine with how everything is going, and they just needed something so simple as that, then that will be fine as well.
Okay. So you make adjustments if they need something else.
Absolutely, absolutely. And I definitely asked them, would they be okay with me sharing resources? And more than likely I'm not getting any drawback, because um the benefits outweigh the risks of
Yeah.
you needing to convert back to where you were before.
Okay. Is there is there a popular request that you see more than others from seniors? Is there a particular area
Um,
that they always ask for a certain thing or that's provided that you see as a need?
yes, so I definitely some of them have told me, unfortunately, that the food cart that we offer is a big help because sadly I've heard that they may receive only $25 or $17. I've heard of that
Monthly?
through food
Mhm.
stamps. So if you're getting $130, that makes a big difference. And if you are still driving, because seniors are still active, they're passing me on the highway. Um, they would they love the flex card because it allows for them to pay for gas. And the way I explain it is your social security check is pretty fixed and it's pretty limited to what you can do. So if you were spending $200 a month on gas, $50 a week, you're now able to put money back in your pocket. So yes, that is what I run into. Because me and you both know that $25 can only get you maybe a loaf of bread,
Yeah, yeah, not much.
not much.
Okay, so the flex card and definitely the food,
Absolutely.
that helps.
Yes, yes. I had one client, her daughter takes her to the doctor and she said, Cantrell, I'm able to help my daughter because you're at will to do what you want to do with the card, as far as long as you know you can buy pet supplies, you can use it for gas. So
Okay,
her daughter is her caretaker. So she's able to put gas in her daughter's car. So it's definitely changing lives, and it's a blessing.
okay.
Mhm.
Do you all ever work with community resources or refer people to community resources?
Not necessarily. It would definitely be something that the agent or me, like a benefits advisor, would do. I know for me, I do it myself. If
Hmm.
I know of a resource, maybe like this weekend, it was two clothing drives that I was able to send some of my clients to with Sonders. Um, the clothing was free and it was, a blessing to be able to share that resource with them because sometimes finances are limited. So
Right.
me on my own term, I would share things and let others know about what is out there in the community because some people don't know the information. So it's valuable information.
Okay. Can I just ask if someone's having issues with their housing, how do
Hmm.
you handle that? I know that this is all about healthcare, but
Hmm.
sometimes people do fall behind on their rent and
Absolutely.
housing becomes an issue. How do you all address that? And that's what I meant by resources. Are there other
Hmm.
resources that you might, the clothing is a great example.
Right, right.
Clothing to the children, yeah.
So because I've been in Atlanta for a long time and even with like I said, Saunders doesn't necessarily do this, but I definitely reach out to individuals who have been in the community and helping for a long time, like nonprofit organizations, whether it's, like you said, housing, if they know to help, even with, resources from like Facebook. You'd be surprised. People know things, they share things, and it's just having that information accessible, and I'll just share it with them. A client that I signed up on a dual plan, he needed help with his bills, and I was able to
Yeah.
tell him about the Lee Heat program. So
Okay.
that
Yep.
was helpful. At Jackson, I think they held one last month at Jackson Memorial for individuals that needed help. So um, obviously, once I tell you, you will have to make the connection. I give you the number
Hmm.
because they're going to want their information, and most people jump on it. They jump on
Yeah.
it, especially if they see that it's not um, too much of a long process. All you had to do was just call somebody at their office and they kind of do an assessment on you to see if they are able to help you. Obviously, you can't be over the income for help. Um, and go from there. Yeah.
Thank you. I don't see any other comments or questions. I do appreciate your time today.
You are welcome, Miss Annette, anytime.
Okay, and I just would like to close us out. In closing, would like to say thank you for sharing your time with us today. Thank you to the audience for coming on and sharing your lunch hour with us. On behalf of my director, Mr. Damon Scott, and our new CEO, Ms. Lorraine Cochran Johnson, we say thank you to everyone. We invite you to come back and listen to us again for Lunch and Learn
Yeah.
experience. The next one will be next Tuesday, the 24th. We're happy that you took this time out of your schedule. Have a great afternoon. Thank
Mm,
you.
thank you.
Bye-bye.
Bye.